Saliva, the fluid that keeps our mouth wet and healthy, is produced by the salivary glands, which are situated under our lower jaw and at each side of our face. A duct runs from the salivary gland into the mouth and delivers saliva to the oral cavity. Saliva moistens, lubricates, and protects the mouth from infection. It has components to neutralize invading bacteria, fungi, and viruses. These compounds or components include glycoprotein, lactoferrin, lysozyme peroxidases, and immunoglobulins. Also to be provided by saliva are mucins to lubricate and amylase to digest food. Speech is facilitated with saliva. Think of giving a talk without having a glass of water by your side. Our sense of taste is better thanks to saliva. Saliva is a lubricant and a binder which breaks down food and makes food easier to swallow. Saliva protects our teeth and gums. With less saliva, the risk of dental caries and gum disease is more likely. Dry mouth is a very common complaint. It is caused by an actual reduction in saliva related to salivary gland hypofunction or reduced function. Or it may be a perceived reduction of saliva, which is described as xerostomia. Dry mouth can be caused by many prescription medications, and this is important for people who are on long-term or multiple medications. Some elderly people will be on multiple tablets, which may predispose them to dry mouth. However, it's very important to be aware that dry mouth is not inevitable as you become older. Several medical conditions, including poorly controlled diabetes, Sjogren's syndrome, and kidney failure, are also causes of dry mouth. Chemotherapy may also be related, but a very common cause of nighttime dryness is mouth breathing. This is common in people who snore and also if you suffer from a blocked nose. Dry mouth is common after radiation involving the salivary glands for treatment of cancer in the head and neck area. And this affects 60 to 80% of these patients. If the salivary glands are in the radiation field during treatment for head and neck cancer, they may not function so well following treatment with less saliva being produced. This is why in the Dublin Dental Hospital we asked our post-radiotherapy head and neck cancer patients about their oral problems. It was surprising to find that 79% of these people reported dry mouth, significant dry mouth. When we asked them about how they dealt with this, 99% said that they used plain tap water and carried a bottle of water with them during the day. 70% mentioned that they chewed sugar-free gum to try to stimulate saliva, and 70% also mentioned that they found an oral gel, such as BioExtra gel, useful to lubricate their mouth. Dry mouth may affect taste and swallowing, especially with dry food. Also, food such as crusty bread may hurt the mouth. If food no longer has taste and your mouth hurts, or if a lump of dry food gets stuck in your mouth or throat, this may contribute to nutritional problems. Not only does dry mouth change taste, it can also cause problems with swallowing and speech. Dry mouth also disrupts sleep, which can affect mood and functioning during the day. This seemingly mundane complaint can therefore cause all kinds of other problems with a significant impact on an individual's general well-being and quality of life. It is very important to question our patients correctly about this complaint. Patients sometimes do not spontaneously report dry mouth themselves, which makes it all the more important that we as healthcare providers proactively ask about it. A short number of questions are usually sufficient to gain insight into the seriousness of the complaint. Online you can find various score lists that are easy to use. Patients may complain about dry mouth on awakening in the morning are needing to sip water to help with nighttime dryness, keeping a glass of water by the bed at night, for example. However, saliva flow is naturally reduced during sleep, and this is not considered to be salivary hypofunction. The questions most relevant to actual dry mouth are needing liquid to aid eating food, swallowing food, and the patient's own opinion regarding their amount of saliva present in their own mouth. It is important to consider quality of life. We want our patients to be able to enjoy life fully. Socialising with friends over a good meal whilst talking together are of course fun things to do. However, this can be distressing for individuals with dry mouth. Unfortunately, the complaint of dry mouth is common. There is extensive research into the management of salivary gland hyperfunction and xerostomia. It is important to try to identify the cause and the severity of the dryness. Research shows that the use of so-called artificial saliva reduces complaints, even though patients often opt to use plain tap water in the long term. The success of dry mouth products is very much dependent on patient preference and may provide great relief in some situations. It is important to advise the dry mouth sufferer in good time about the existence of such products and encourage use, because the sooner that somebody who suffers from dry mouth starts to moisten their mouth, the more this will prevent complaints arising later. Keep your mouth and lips moisturised regularly. Don't suffer in silence and have a conversation with your dentist or doctor about your symptoms. Regularly sip or spray water into your mouth or chew a piece of cucumber, which can contribute to a more pleasant mouthfeel. Keep a glass of water by your bedside. Using a mouth spray or a rinse during the day and a gel at night may help, as both will moisten the mouth. Good advice about the right toothpaste and mouthwash without foaming agents or alcohol will help to keep your mouth clean and fresh. Try a sugar-free chewing gum. Avoid frequent sugar in your diet. In the presence of natural teeth, it's very important to avoid products containing citric acid, and my advice is to always read the labels on products. Ask your dentist about the need for high fluoride products to prevent dental caries. Controlling oral dryness makes a great difference in quality of life, and that's why we advise our patients with dry mouth about mouth and lip moisturising products. Reducing the symptoms of dry mouth improves oral health and, very importantly, the quality of life.